After 12 years in the position, Blue Cross Blue Shield of Massachusetts CEO Andrew Dreyfus is retiring. He claims he is quitting the largest health insurance in the state to instruct, guide, write for, and advise startup businesses. A Dreyfus protege, Sarah Easeling, will take over as CEO of Blue Cross on January 1st. The 64-year-old Dreyfus fought for a reform in how health insurance pay for care, rewarding hospitals and doctors for providing high-quality care rather than just those who do the most tests and procedures. Additionally, he collaborated with groups to pass historic health care reform measures both in Massachusetts and across the country. Dreyfus discussed the problems that lay ahead as well as how the health care industry is changing with WBUR. You spent a lot of time at Blue Cross promoting innovative payment structures that emphasize equity and quality. Have these initiatives been effective? Would you have preferred more effort? Our payment strategy advanced two important healthcare objectives. It raised the standard of care and reduced costs. We achieved a lot of success in primary care, where our payment model was heavily concentrated, but not as much in specialty care. We currently pay primary care and cognitive specialists like psychiatry considerably less than we ought to. Additionally, we overpay for specialty care, particularly surgery. In some respects, I'm proud of what we were able to do, but I'm also unhappy that we weren't able to do even more. I'm really happy that we now include health equity benchmarks in our payment agreements with doctors and hospitals, said the executive. Massachusetts implemented laws in 2006 to provide health insurance to all citizens. Then in 2012 it passed legislation to control medical expenses. The Affordable Care Act was enacted on a federal level. Have access to and the cost of healthcare improved for the state and the nation? Is it progress if the majority of residents in the state still put off getting medical treatment because the prices are too high? In Massachusetts, 98% of people have access to healthcare. It's a significant improvement, and numerous studies have demonstrated that having insurance leads to better care and better outcomes. We are aware of the significance of health insurance, yet it is insufficient. People still encounter obstacles to care, as is well known. Our healthcare system is flawed and frequently fails. But I'm incredibly proud of the advancements Massachusetts has achieved. The degree to which we collaborate is another feature of the Massachusetts healthcare system that I would characterize as special. Even if there are times when we disagree, whether it be with regard to health insurance plans, employers, hospitals, labor, or elected officials, when a significant issue arises, like as the COVID pandemic, the mental health crisis, or the opioid crisis, we tend to band together. To fix the issue, we cooperate. What do you think the pandemic's long-term implications will be? What aspects of how we obtain healthcare will endure? The transition to virtual care will continue in the field of mental health treatment. Prior to COVID, Blue Cross would only cover a small number of virtual mental health appointments. We've now funded nearly 8 million online counseling sessions this year. Just a revolution, really. We now have a different perspective on how to treat respiratory infections. The practice of masking, which has long been used extensively in Asian nations, will increasingly be a part of our healthcare system. The early data indicate that a sizable portion of COVID patients would experience some extended COVID symptoms. However, long COVID is a significant uncertainty. Setting up the proper clinical response to that is going to need a lot of work on our part. The quickness with which the COVID vaccine and medicine breakthrough occurred was a fantastic lesson. That demonstrates the potential of life sciences innovation and ingenuity in the United States and around the world. A sort of silver lining would be that. When you reflect on your career, do you have any regrets? I'm so happy of what this business and this community have been able to accomplish in the area of healthcare, including increasing coverage, addressing the opioid crisis, enhancing mental health care, tackling health inequities, and working to make health care more affordable. Whenever one looks back, they wonder, could we have gone more quickly in some of these areas? I often consider that.